Hydrocortisone. Expanded lecture notes. Welcome to our in-depth exploration of hydrocortisone, a cornerstone medication in the world of endocrinology and beyond. From managing adrenal insufficiency to treating inflammatory conditions, hydrocortisone plays a vital role in modern medicine. Join me as we dive into the fascinating world of hydrocortisone, uncovering its mechanisms, applications, and importance in patient care. Objectives. By the end of this lecture, the learner should be able to 1. Define hydrocortisone and explain its pharmacological class. 2. Describe its history, classification, and properties. 3. Explain its mechanism of action, pharmacokinetics, and pharmacodynamics. 4. Discuss clinical uses with emphasis on ICU, anesthesia, and emergency settings. 5. Identify contraindications, side effects, and precautions. 6. Compare hydrocortisone with other corticosteroids. 7. Review current research, trends, and patient education strategies. 8. Apply knowledge to practical nursing and medical care. Other names for hydrocortisone. 1. Generic. Hydrocortisone is the generic name for this medication, widely used in various formulations and brand names. 2. Brand names. Hydrocortisone is marketed under several brand names, including Solu-Cortif, Hydrocortisone, and A-Hydrocort, each with specific formulations and uses. 3. Chemical. Hydrocortisone is also known as cortisol, the bioactive form of the natural glucocorticoid hormone produced by the adrenal gland, playing a crucial role in regulating metabolism, immune response, and stress response. Introduction to hydrocortisone. 1. Synthetic form of cortisol. Hydrocortisone is a synthetic version of cortisol, a naturally occurring glucocorticoid hormone produced by the adrenal cortex. 2. Physiological roles. Cortisol plays a crucial role in regulating metabolism, immune response, and stress adaptation, helping the body respond to stress and maintain homeostasis. 3. Critical care applications. Hydrocortisone has been widely studied in critical care settings, particularly for managing septic shock, adrenal insufficiency, and perioperative care, due to its potent anti-inflammatory and immunosuppressive effects. 4. Anti-inflammatory effects. Research shows that hydrocortisone reduces inflammatory cytokines, which are proteins that promote inflammation, thereby helping to mitigate the inflammatory response. 5. Hemodynamic stabilization. Hydrocortisone also helps stabilize hemodynamics, or blood flow, which is critical in patients with septic shock or other cardiovascular conditions, improving patient outcomes and reducing mortality. Debunking myths about hydrocortisone. 1. Myth. Hydrocortisone only suppresses immunity. Fact. At physiological doses, hydrocortisone is essential for maintaining homeostasis, vascular tone, and glucose balance, highlighting its importance in normal bodily functions. 2. Myth. Steroids like hydrocortisone always cause severe side effects. Fact. Side effects associated with hydrocortisone are dose and duration dependent, meaning that short-term use in emergency situations is usually safe and well tolerated, while long-term or high-dose use may increase the risk of adverse effects. Organizational definitions of hydrocortisone. 1. World Health Organization (WHO). The WHO lists hydrocortisone as an essential medicine for treating adrenal insufficiency and for emergency use, highlighting its importance in global healthcare. 2. Food and Drug Administration (FDA), USA. The FDA has approved hydrocortisone for use as replacement therapy in adrenal insufficiency, as well as for its anti-inflammatory and immunosuppressive properties, demonstrating its therapeutic value. 3. British National Formulary (BNF). The BNF classifies hydrocortisone as a corticosteroid used in the treatment of endocrine disorders, shock, and various inflammatory conditions, providing guidance on its clinical applications. History of hydrocortisone. 1. 1936. Cortisol, a naturally occurring glucocorticoid hormone, was first identified, marking the beginning of research into its therapeutic potential. 2. 1949. Philip Hench and Edward Kendall isolated cortisone, a glucocorticoid hormone, and were awarded the Nobel Prize for its groundbreaking use in treating rheumatoid arthritis, demonstrating the therapeutic value of glucocorticoids. 3. 1950s. Hydrocortisone was introduced as the first clinically usable glucocorticoid, paving the way for its widespread use in medicine. 4. Over decades, hydrocortisone has been refined into various formulations, including IV and oral forms, for use in critical care and anesthesia, allowing for more effective treatment of patients in emergency situations. Classification of hydrocortisone. 1. Pharmacological class. Hydrocortisone belongs to the glucocorticoid class of medications, which mimic the effects of cortisol, a naturally occurring hormone produced by the adrenal gland. 2. Subclass. Hydrocortisone is a subclass of corticosteroids, specifically a short-acting glucocorticoid, meaning it has a relatively short duration of action in the body. 3. Duration. Hydrocortisone has a short to intermediate duration of action, lasting approximately 8 to 12 hours, which allows for flexible dosing and titration. 4. Potency. Hydrocortisone has a balanced action, with a glucocorticoid to mineralocorticoid activity ratio of approximately 1:1, meaning it has both glucocorticoid and mineralocorticoid effects, making it suitable for replacement therapy adrenal insufficiency. Chemical properties of hydrocortisone. 1. Formula. The chemical formula for hydrocortisone is C21H30O5, which represents its molecular structure and composition. 2. Molecular weight. Hydrocortisone has a molecular weight of 360.5 grams per mole, which is a measure of its molecular size and mass. 3. Derived from cholesterol backbone. Hydrocortisone is derived from a cholesterol backbone, also known as a steroid nucleus, which is the basic structural framework for all steroid hormones, including glucocorticoids like hydrocortisone. Physical properties of hydrocortisone. 1. Appearance. Hydrocortisone is a white crystalline powder, which describes its physical appearance and texture. 2. Solubility. Hydrocortisone is practically insoluble in water, but soluble in alcohols, which affects its formulation and administration. 3. Stability. Hydrocortisone is stable in its dry form, but it can be degraded by exposure to light and moisture, which requires careful handling and storage to maintain its potency. Mechanism of action of hydrocortisone. 1. Glucocorticoid receptor binding. Hydrocortisone binds to glucocorticoid receptors in the cytoplasm, which then translocates into the nucleus, altering gene transcription and influencing various cellular processes. 2. Anti-inflammatory effect. Hydrocortisone inhibits phospholipase A2, an enzyme involved in the production of pro-inflammatory mediators, thereby reducing the synthesis of prostaglandins and leukotrienes, which contribute to inflammation. 3. Immunosuppressive effect. Hydrocortisone reduces lymphocyte proliferation and cytokine release, which helps to suppress the immune response and prevent excessive inflammation. 4. Metabolic effect. Hydrocortisone promotes gluconeogenesis, glucose production, protein catabolism, protein breakdown, and lipolysis breakdown, which affects glucose and lipid metabolism. 5. Mineralocorticoid effect. Hydrocortisone has a mineralocorticoid effect, enhancing sodium and water retention, and potassium excretion, which can impact fluid balance and electrolyte levels in the body. Pharmacokinetics of hydrocortisone. 1. Absorption. Hydrocortisone has a high oral bioavailability of approximately 96%, meaning that most of the oral dose is absorbed into the bloodstream. 2. Distribution. Hydrocortisone is widely distributed through the body and is protein-bound to corticosteroid-binding globulin, which affects its availability and activity. 3. Metabolism. Hydrocortisone is metabolized in the liver by the 3-cypriot pounds A4 enzyme, which breaks down the molecule into inactive metabolites. 4. Elimination half-life. Hydrocortisone has a short elimination half-life of 1.5–2 hours, which means it is rapidly cleared from the body. 5. Excretion. Hydrocortisone is excreted in the urine as inactive metabolites, which are removed from the body through renal elimination. Pharmacodynamics of hydrocortisone. 1. Onset. The onset of action for hydrocortisone varies depending on the route of administration. IV administration produces a rapid effect within minutes, while oral administration takes 1 to 2 hours to take effect. 2. Duration. Hydrocortisone has a duration of action of 8 to 12 hours, which is the length of time its effects are sustained in the body. 3. Potency. Hydrocortisone has a potency equivalent to 1x relative to natural cortisol, meaning it has a similar potency to the body's natural glucocorticoid hormone. Storage and disposal of hydrocortisone. 1. Storage conditions. Hydrocortisone should be stored in a cool, dry place, protected from light, to maintain its stability and potency. 2. Temperature control. Injectable vials of hydrocortisone should be stored at a temperature range of 20 to 25 degrees Celsius, which helps to preserve its chemical integrity. 3. Disposal protocol. Hydrocortisone and its packaging should be disposed of according to hospital pharmaceutical waste protocols, ensuring safe and environmentally responsible disposal practices. Drug interactions with hydrocortisone. 1. Enzyme inducers phenytoin, rifampicin. These medications can decrease the effect of hydrocortisone by increasing its metabolism, potentially reducing its therapeutic efficacy. 2. Enzyme inhibitors ketoconazole. These medications can increase the effect and toxicity of hydrocortisone by decreasing its metabolism, potentially leading to increased side effects. 3. NSAIDs. Concomitant use of hydrocortisone and NSAIDs may increase the risk of gastrointestinal bleeding due to the additive effect of medications on the gastrointestinal mucosa. 4. Diuretics. Hydrocortisone may increase the risk of hypokalemia, low potassium levels, when used with diuretics, which can also cause potassium loss. 5. Vaccines. Hydrocortisone's immunosuppressive effects may reduce the immune response to vaccines, potentially decreasing their effectiveness. Clinical uses of hydrocortisone. 1. Adrenal insufficiency, Addison's disease. Hydrocortisone is used as replacement therapy to manage adrenal insufficiency, a condition where the adrenal glands do not produce enough cortisol. 2. Septic shock. Low-dose hydrocortisone therapy is used to support patients with septic shock, helping to stabilize blood pressure and improve outcomes. 3. Asthma exacerbations. Hydrocortisone is used to treat severe asthma exacerbations, reducing inflammation and improving respiratory function. 4. Allergic reactions and anaphylaxis. Hydrocortisone is used to treat severe allergic reactions, including anaphylaxis, to reduce inflammation and prevent further reactions. 5. Cerebral edema. Hydrocortisone may be used in limited cases to manage cerebral edema, brain swelling, although its use is typically reserved for specific situations. 6. Rheumatologic and autoimmune diseases. Hydrocortisone is used to treat various rheumatologic and autoimmune diseases, such as rheumatoid arthritis and lupus, to reduce inflammation and modulate the immune response. Use of hydrocortisone in ICU. 1. Management of septic shock. Hydrocortisone is used in the management of septic shock that is refractory to fluids and vasopressors, helping to improve hemodynamic stability and patient outcomes. 2. Stress dose steroid. Hydrocortisone is used as stress dose steroids in critically ill patients with adrenal suppression, providing essential glucocorticoid support to patients who may have impaired adrenal function. 3. Control of severe inflammation. Hydrocortisone is used to control severe inflammation in conditions as acute respiratory distress syndrome, ARDS, and acute asthma, reducing the inflammatory response and improving patient outcomes. Use of hydrocortisone in anesthesia. 1. Perioperative stress dose. Hydrocortisone is administered as a perioperative stress dose to patients with chronic steroid therapy, providing additional glucocorticoid support to manage the stress of surgery. 2. Prevention adrenal crisis. Hydrocortisone helps prevent adrenal crisis during surgery in patients with adrenal insufficiency or those on long-term steroid therapy, ensuring a stable physiological response to surgical stress. 3. Adjunct in allergic reactions. Hydrocortisone is used as adjunct in the management of allergic or anaphylactic reactions that occur intraoperatively, helping to reduce inflammation and prevent further reactions. Use of hydrocortisone in emergencies. 1. Acute adrenal crisis. Hydrocortisone is used to treat acute adrenal crisis, a life-threatening condition that occurs when the adrenal glands do not produce enough cortisol and aldosterone. 2. Severe anaphylaxis. Hydrocortisone is administered to treat severe anaphylaxis, a potentially life-threatening allergic reaction that requires immediate medical attention. 3. Status asthmaticus. Hydrocortisone is used to treat status asthmaticus, a severe and life-threatening asthma exacerbation that does not respond to standard treatments. 4. Shock-resistant to fluids vasopressors. Hydrocortisone is used to treat shock that is resistant to fluids and vasopressors, helping to stabilize blood pressure and improve patient outcomes. Nursing management of hydrocortisone. 1. Monitoring. Nurses should closely monitor vital signs, glucose levels, and electrolytes in patients receiving hydrocortisone, as it can impact these parameters. 2. IV administration. Hydrocortisone should be administered intravenously slowly to avoid arrhythmias, which can be a potential side effect of rapid administration. 3. Infection surveillance. Nurses should be vigilant for signs of infection in patients receiving hydrocortisone, as it can suppress the immune system and increase the risk of infections. 4. Patient education. Nurses should educate patients on the importance of tapering the dose of hydrocortisone when discontinuing treatment, as abrupt withdrawal can lead to adrenal insufficiency and other complications. Administration and dosage of hydrocortisone. 1. IV/IM administration. In acute settings, hydrocortisone can be administered intravenously or intramuscularly at a dose of 100 mg every 6 to 8 hours, providing rapid glucocorticoid support. 2. Oral administration. For replacement therapy, the typical oral dose of hydrocortisone is 20 to 30 mg per day, mimicking the body's natural cortisol production. 3. Emergency dosing. In cases of adrenal crisis, an initial IV bolus of 100 mg is administered, followed by a continuous infusion of 200 mg over 24 hours, providing high-dose glucocorticoid support to manage the life-threatening condition. Side effects of hydrocortisone. 1. Hyperglycemia. Hydrocortisone can cause an increase in blood sugar levels, which may require adjustments to diabetes treatment. 2. Hypertension. Long-term use of hydrocortisone can lead to increased blood pressure, potentially contributing to cardiovascular issues. 3. Fluid retention. Hydrocortisone can cause the body to retain fluid, leading to swelling and weight gain. 4. Mood changes. Some individuals may experience mood swings, anxiety, or depression due to the hormonal effects of hydrocortisone. 5. Increased infection risk. Hydrocortisone's immunosuppressive properties can increase the risk of infections, as the body's natural defenses are suppressed. Serious side effects of hydrocortisone. 1. GI bleeding, ulcers. Hydrocortisone can increase the risk of gastrointestinal bleeding and ulcers, particularly when used in high doses or for extended periods. 2. Osteoporosis. Long-term use. Prolonged use of hydrocortisone can lead to bone loss and osteoporosis, increasing the risk of fractures. 3. Myopathy. Hydrocortisone can cause muscle weakness and wasting, particularly with long-term use or high doses. 4. Psychosis. In rare cases, hydrocortisone causes severe mental disturbances, including psychosis, especially in individuals with a history of mental health conditions. 5. Adrenal suppression. Long-term use of hydrocortisone can suppress the body's natural production of cortisol, leading to adrenal insufficiency and potentially life-threatening complications if not managed properly. Contraindications of hydrocortisone. 1. Systemic fungal infections. Hydrocortisone is contraindicated in patients with systemic fungal infections, as its immunosuppressive effects can worsen the infection. 2. Hypersensitivity. Patients with a known hypersensitivity to hydrocortisone or its components should not receive the medication. 3. Live vaccines. Hydrocortisone is contraindicated with live vaccines in immunosuppressed patients, as the medication can impair the immune response and increase the risk of vaccine-related complications. Precautions with hydrocortisone. 1. Diabetes mellitus. Hydrocortisone can worsen glycemic control in patients with diabetes, requiring close monitoring and potential adjustments to diabetes management. 2. Hypertension. Patients with hypertension should be monitored closely, as hydrocortisone can cause fluid retention and increase blood pressure. 3. Peptic ulcer disease. Hydrocortisone may exacerbate peptic ulcer disease, and patients with a history of ulcers should be treated with caution. 4. Osteoporosis. Long-term use of hydrocortisone can contribute to bone loss, and patients with osteoporosis should be monitored and potentially treated with bone protective agents. 5. Psychiatric disorders. Hydrocortisone can exacerbate psychiatric conditions, such as depression or psychosis, and patients with a history of psychiatric disorders should be closely monitored for changes in mood or behavior. Advantages of hydrocortisone. 1. Closest to natural cortisol. Hydrocortisone is a synthetic version of cortisol, the body's natural glucocorticoid, making it a suitable replacement therapy. 2. Balanced glucocorticoid and mineralocorticoid effect. Hydrocortisone provides both glucocorticoid and mineralocorticoid effects, mimicking the body's natural cortisol activity and helping to regulate various physiological processes. 3. Rapid onset in IV form. The intravenous form of hydrocortisone has a rapid onset of action, making it effective in acute settings, such as adrenal crisis or severe allergic reactions. Disadvantages of hydrocortisone. 1. Short half-life. Hydrocortisone has a relatively short half-life, requiring frequent dosing to maintain therapeutic effects, which can be inconvenient for patients. 2. More mineralocorticoid effect. Compared to other glucocorticoids, hydrocortisone has a more pronounced mineralocorticoid effect, which can lead to increased fluid retention and electrolyte imbalances, particularly with long-term use. Clinical considerations for hydrocortisone. 1. Tapering after prolonged use. To avoid adrenal insufficiency, hydrocortisone should be tapered gradually after prolonged use, rather than stopped abruptly. 2. Stress dosing perioperatively. Patients on long-term hydrocortisone therapy may require stress dosing perioperatively to ensure adequate glucocorticoid coverage during surgical stress. 3. Monitoring electrolytes and blood sugar. Patients receiving hydrocortisone should be monitored for changes in electrolytes and blood sugar levels, as the medication can cause fluid retention, electrolyte imbalances, and hyperglycemia. Comparison of hydrocortisone with other glucocorticoids. 1. Hydrocortisone has a glucocorticoid potency of 1 and a mineralocorticoid potency of 1, with a duration of action of 8 to 12 hours. 2. Prednisone has a glucocorticoid potency of 4, which is 4 times more potent than hydrocortisone, and a mineralocorticoid potency of 0.8. Its duration of action is 12 to 36 hours. 3. Dexamethasone is a highly potent glucocorticoid with a potency of 25, and has negligible mineralocorticoid activity. Its duration of action is 36 to 72 hours, making it suitable for long-term effects. 4. Methylprednisolone has a glucocorticoid potency of 5 and a mineralocorticoid potency of 0.5. Its duration of action is 12 to 36 hours, and it is often used for its potent anti-inflammatory effects. Additional information about hydrocortisone. 1. Essential drug for adrenal replacement therapy. Hydrocortisone is a crucial medication for patients with adrenal insufficiency, providing the necessary glucocorticoid replacement to maintain physiological function. 2. Available in various forms. Hydrocortisone is available in multiple formulations, including oral tablets, injectable solutions, and topical creams or ointments, allowing for flexible administration and treatment options depending on the patient's needs. Current trends in hydrocortisone therapy. 1. Low-dose hydrocortisone therapy in septic shock is recommended in guidelines, particularly for patients who remain hemodynamically unstable despite adequate fluid resuscitation and vasopressor therapy, as outlined in the 2021 Surviving Sepsis Campaign Guidelines. 2. Ongoing research is investigating the role of hydrocortisone in managing COVID-19-related acute respiratory distress syndrome, ARDS, exploring its potential anti-inflammatory benefits in mitigating severe respiratory complications. Recent research on hydrocortisone in sepsis. 1. Recent trials show that hydrocortisone can improve survival in sepsis patients with adrenal insufficiency. 2. Studies suggest that hydrocortisone can help reduce the need for vasopressors in septic shock patients, make treatment more effective. Patient education on hydrocortisone. 1. Do not stop taking hydrocortisone suddenly, as this can lead to adrenal crisis, a potentially life-threatening condition. 2. Carry a steroid card or wear a medical alert bracelet to inform healthcare providers of your hydrocortisone treatment in case of an emergency. 3. Monitor for signs of infection, blood sugar changes, and blood pressure changes, as hydrocortisone can affect these parameters. 4. Take oral hydrocortisone with food to reduce gastrointestinal upset and minimize stomach irritation. Conclusion on hydrocortisone. 1. Hydrocortisone is considered the gold standard treatment for adrenal insufficiency due to its ability to effectively replace the body's natural cortisol. 2. In critical care emergencies, such as adrenal crisis or septic shock, hydrocortisone is a crucial medication that can help stabilize patients and improve outcomes. 3. Hydrocortisone's balanced glucocorticoid and mineralocorticoid effect sets it apart from other corticosteroids, making it an ideal choice for replacement therapy. 4. Proper monitoring of patients taking hydrocortisone is essential to prevent and manage potential side effects, such as changes in blood sugar, blood pressure, or electrolyte levels. 5. Educating patients on the safe use of hydrocortisone, including the importance of tapering and not stopping the medication abruptly, is crucial to preventing adrenal crisis and ensuring effective treatment. Take-home tips on hydrocortisone use. 1. Always give stress-dose steroids in surgery for patients on chronic steroid therapy to prevent adrenal crisis and ensure adequate glucocorticoid coverage during surgical stress. 2. Monitor electrolytes, glucose, and blood pressure in patients taking hydrocortisone, as the medication can affect these parameters and require adjustments to treatment. 3. Never stop hydrocortisone abruptly, as this can lead to adrenal crisis. Instead, taper the dose gradually to allow the body to adjust and prevent withdrawal symptoms. 4. The IV form of hydrocortisone is life-saving in situations such as shock and adrenal crisis, providing rapid glucocorticoid support and helping to stabilize the patient. Professional quote: "Hydrocortisone is not just a drug, it is life support for the stressed body." This quote highlights the critical role hydrocortisone plays in supporting the body's physiological response to stress, particularly in situations of adrenal insufficiency or crisis. It underscores the medication's importance in maintaining homeostasis and preventing life-threatening complications. Thank you for watching. If you liked this content, don't forget to like to show your support, comment and share your thoughts. Share with your friends and family. Subscribe for more exciting content. Your engagement means the world to us. Stay tuned for more.